I chose nursing as a career because as a small child I had some experiences at the hospital as a patient and was very intrigued by the opportunity to make that better than some of the experiences I had and as good as some of the experiences that I had. I was really intrigued by two different areas. One was obstetrics and one was pediatrics. So I started out in obstetrics and also worked in the newborn nursery as part of that, and just really enjoyed working with the infants and the smaller children, and decided to get my master's as a pediatric nurse practitioner and just loved it. My transition from nursing practice to nursing education was always mutual. I've always done both. I went into education fairly early in my career. I fell in love with it. It had been my intention to teach later in life, but I liked it so much that I went into it more full-time and kept my practice as well. As a pediatric nurse practitioner or any kind of nurse practitioner, you have to maintain your practice. So myself and most of the people here have a practice in addition to their teaching role. I love the size school that Shenandoah is, and I like the smaller institutions better. I think that you have the opportunity to get to know the students and the faculty and the community on a more personal level, and that's real important to me. In the education administrative part of academics and health professions, we have a real big need to work directly with the community. When we talk about community, we clearly think of Winchester and this closer region as our community. We have a campus in Northern Virginia. We're opening up a new campus in Fairfax. We have students from all over. Shenandoah has some very distinct advantages and strengths of our nursing program. Probably one of the most unique things for the state of Virginia is that we're one of the few programs, if not the only, that admits students as freshmen. That is not the case in many schools. Many schools you come as a freshman and you're usually around your junior year you apply for the last 2 years, and it's very competitive, and you may have spent 2 years there and not get in. The thing we hear from the students the most is the real close relationship with their faculty. Because we're small enough, we have small classes. Probably our biggest nursing classes range between 26 and 36 students. On Northern Virginia campus, we may go up to 40, but that's pretty small for undergraduate nursing classes. And our clinical classes, we have usually 1 to 8, so it's 1 faculty member to every 8 students. You really get to know your students, you get to know their problems, their strengths. You can help guide them and mentor them in ways that when you have 100 or 200 students, you miss it. To be a nurse, you have to have what we call the art of nursing. The art is that beautiful ability to connect with people and care about people and wanting to do that. We call it the caring of nursing, that you want to help somebody. But the awesome thing about nursing is there's lots of opportunities.